Oh my God, you guys. Oh my God. That was nuts. Hey guys, welcome back to my channel and another video in my Rotate With Me vlog series in which I am taking you guys with me on my third year of medical school rotations. It has been quite the journey so far as I've taken you guys with me into some of my rotations including psychiatry, OBGYN, and surgery. And now I am here to introduce you to the field of internal medicine. So we won't go too far in depth in this video. However, internal medicine very generally is the prevention, diagnosis, and treatment of diseases in adults. Adults, you guys. If it was peds, it would be pediatrics. So adults. Where it gets kind of confusing is that internal medicine can both be inpatient and outpatient. Inpatient meaning that you are a patient in the hospital, outpatient being outside somewhere. You're seeing a doctor in a clinic, in a private practice, health center, or any of the above. But at the end of the day, it all comes down to the fact of internal medicine physicians are able to diagnose and treat a variety of diseases. So for my internal medicine rotation, it is 10 weeks long, you guys. 10 weeks, the longest rotation of medical school. And understandably so, right? Most diseases are amongst adults and they're chronic type of common things. So internal medicine is just the cream of the crop. So 10 weeks split up into three-week blocks and one extra week of like other stuff I gotta do. So those three-week blocks consist of the first block where I am on inpatient floors in the hospital treating patients who are admitted in the hospital. The second block in which I am on a selective 3-week of hematology and oncology, so blood and cancer. And the third block, which will be back to the floor, inpatient floors to see more stuff. The first and third block, both are on floors, but they're at different hospitals. So you'll get to see like 2 different populations. So I'm starting off on inpatient floors and I'm super excited because I have an interest in the field of internal medicine. So let's see where it goes. Hey guys, good morning. So it is currently 7 o'clock on Sunday. I am on call today. So internal medicine, similar to other specialties, has days in which you have to be on call. So we have like weekday calls where you just kind of stay later, and then you have weekend calls where you actually have to come in on your on a weekend, on a Saturday or Sunday, and usually work a 12-hour shift, so 7 to 7. I'm hoping that they do not keep me for the entire 12 hours. So I think it's kind of just like a hit or miss experience depending on how busy the service is that day and whatnot. So hopefully I can just see a few patients and then leave after we round. So that is, you know, fingers crossed for that. So one thing about the third year of medical school that I think really worked in my favor was that I live on the same block as my medical school and hospital, and I live 5 minutes from the affiliate hospital that I've rotated at during my third year. So everywhere I've ever had to go for my clinical rotations has been within like a 5 to 8 minute drive from my house, which has really blessed me in experiences and days like this where it's a Sunday. I was out with my friends yesterday, you know, and I'm tired, but if I gotta be there at 7:30, I can wake up at 7, you know, whereas a lot of medical students, I think, by their third and fourth year, like to move away from the school and kind of get out and not be so constrained and feel like they're on campus or near campus. And for me, it's like I don't live in on-campus housing. I live in a townhouse, but I still live nearby because we spend all of our days, you know, on campus or in the hospital. So for me, it's just worked out. It's convenient for me. I guess it's just what you prioritize and like what you prefer. If you don't mind waking up a little bit earlier because you have a commute, then that might be something that's, you know, works for you to get away from campus. But for me, I like every minute of sleep that I can get. So I stuck nearby campus, and it's worked out really well. So, you know, I'm already at the hospital. That short little drive that I've been talking, like, I'm already here. So, yeah. All right, guys, so typically how this works is that you come in the morning around 7:30, and you print off a list of your team's patients. So it has all the patients that your team is seeing. So I'm on a certain team, and we are seeing 12 patients. So in those 12 patients, I choose either new patients who were admitted overnight or patients who I was following from the day before. So I usually carry about 2 patients, 3 if they're like not complicated, but then I'll go and see those 2 patients, you know, do a physical exam, all of that stuff, check the notes, see if anything happened overnight, and then when we round, I will present my 2 patients that I saw. So my 2 patients this morning are 2 people I've been following, so I'm pretty familiar with them and everything. One has heart failure and a stroke, and one has really bad lung disease. So she's on oxygen, and young woman and really struggling to breathe. She has autoimmune disorders that's causing her body to attack its lungs. So let me give you guys a quick rundown on rounding, because I mentioned rounding. So, like I said, on internal medicine inpatient, you typically come in somewhere between 6 and 7 in the morning. You do what's called pre-rounding, where essentially you see your patients that you have picked up, you go do a physical exam, check their chart, make sure you know everything about that patient because you pre-rounded on them, and you prepare your presentation for rounding. Rounding is when the entire medical team comes together to discuss the patient, discuss the plan for that patient, and then go see the patient together as a large team. So basically the structure is that you see your patient, prepare for your presentation, you present it during rounds to the entire team who may or may not have seen your patient or know about your patient. So you have to give a thorough presentation so that even if somebody on the team is not knowledgeable of your patient, they can get the gist based off of your presentation so that they know what's going on. In addition, you're presenting to the residents, the senior residents, as well as the attending, who is the boss doctor, who's in charge of all of us, you know? So you just wanna come to rounds and have your presentation ready, because it is embarrassing to not be prepared, you guys. I cannot tell a lie. So this is the gist of rounding. We discuss the patients, you let the team know what your plan is for your patient. I wanna keep them on this drug, I wanna take them off, I wanna send them for this test, I wanna discharge them, they're ready to go. You give your reasons why, we all discuss it. The head doc just, you know, let you know if your plan is good or not. And then after we do all of that, discuss all of the patients, then we all as a team go to see all of the patients. So the big team of us come in the room and let the patient know what's going on, what we discussed, and what the plan for them is going to be. That is rounding. It takes forever, you guys, because you're not only discussing every single patient, but then you're seeing every patient. So it's a very long process, especially when you have a thorough, long list of patients to get through, and you have to discuss each one. Some attending doctors do walking rounds in which you walk from floor to floor, and outside of the patient room, you discuss it right there and then go see that patient. Outside the next patient room, discuss it, go see the patient. Walking rounds, you're walking around on the floor. Other physicians do sitting rounds or, you know, table rounds in which you get together and discuss every single patient beforehand all at once, and then you just go see them all individually. So either way, you know, it's physician preference. It both takes long, honestly, but that is rounding, my friends. And now I'm just gonna grab some breakfast and coffee in my favorite little hospital diner. It's called the Green Room. I love it here, you guys. So this is my breakfast, you guys. See this? So good. So the thing about working on like a team in medicine, in any specialty really, is that the doctors and residents, they're employees, right? So they're getting paid and they have a certain amount of work that needs to be done like every single day, right? So
if they have to see 20 patients and do 20 patient notes from those patients that they've seen, they have, you know, their work day to get that done. So a lot of them will end up working through the entire day and grab food when they can, and they'll work through their lunch and eat at the same time and whatnot. We as medical students have to keep in mind that we are not employees, you guys. And while they might have to work through their lunch hour and eat on the go, that is not necessarily our case, and we're not getting paid to do this. So take your lunch hour, sneak away, eat your breakfast, eat your lunch, because at the end of the day, like, we're paying to learn, and you shouldn't compromise your diet and everything in order to be like a good team member. Like, nah, eat your breakfast, eat your lunch. Best believe I sneak away to make sure I get fed.
So sometimes my patients are on precautions. So some of them are on like contact precautions, airborne precautions. You have to use appropriate PPE and protective wear to not only protect the patient, but protect yourself as well. So, gotta put this on. Helps prevent the spread of infection and other things like that. Alright guys, so I just got dismissed. It's about 1 o'clock. So I am done for the day for my call shift. So that wasn't too bad, 7 a.m. to 1 p.m. So now I'm actually headed into the medical school because I am a work study student. So I have a little work study job on campus. I work for one of the medical departments and I do some of the research work for them. Just with like secretarial duties and data entry and stuff like that. So I have a few assignments to kind of finish up. So now that I have some time, I'm gonna go and do that today for a few hours. Get a little money. Work study position, you guys, I'm basically working on a research project right now for the Department of Preventative Medicine, and they are going into nursing home facilities throughout New Jersey, and they are COVID testing the residents of the facility as well as the staff, and they're looking at you know, who's testing positive and whatnot. And I guess we're gonna eventually do some research and data tracking on these individuals. So for right now, I kind of just go through the research or go through the tests and send letters to the people informing them of their COVID results. So it's kind of like a lot of secretarial work, which is fine with me because it's easy and I'm getting paid for it. And then eventually we are going to move over to like looking at data and kind of like analyzing data and writing papers about it and whatnot. So it's a cool little gig for med school because I do not advise, you know, trying to work any type of job that takes away from your studies while you're in medical school. So this is like easy work that doesn't require much brain power that I'm getting paid for, and hopefully as well will double down and also eventually get some like research experience and hopefully publish a paper or something as a result. So trying to kill multiple birds with one stone is the goal in medical school. Things that could both double as an educational or academic opportunity as well as a financial opportunity is the way to go.
Today is just one of those days, guys, where I'm just exhausted. I really don't even understand why, because I'm getting like enough sleep. I got enough sleep last night, but I think it's just a tiring rotation. Internal medicine is definitely one of the more like active rotations. You're on your feet a lot, you're running up and down from floor to floor, you're running from room to room to see different patients, do different things, make different calls. So it's just a lot of activity. Fortunately for me, I've actually been tracking kind of like my activity levels through my Apple Watch. You can see by 11:15 already this morning, I've already burned almost 40% of the calories I burn for the day. 12 minutes of exercise. I really haven't done exercise. It's just because I take the steps rather than take the elevator. And then I've already been standing for 6 hours. Like, I really don't even know how that's possible because I haven't even been up for 6 hours. But all that to say, your girl been moving. So now I'm gonna go to one of my favorite parts of this hospital in Newark, and that is the library. So we swipe in here. This is the library, guys. I come in here to study or take a nap. This right here.
I'm gonna put in transport for the patient to be in our department by 4. That's fine? Can you hear me now? Hello? I'm sure once you guys place it on safe mode. So I'm gonna have the patient in the department by 4 o'clock. That's fine? Because you said between 4 and 4:30.
So that's part of being a med student, you guys, is like you're kind of the one responsible for doing these little tasks for your patient and for your patient's care that, you know, the residents and the doctors don't have time to do. So running down to the lab for blood work, running to MRI to complete these forms, like all these little things, like we're kind of tasked with. So I get my steps in. So one thing about being on inpatient internal medicine, you guys, is that when people come into the emergency room and they have problems that require them to stay in the hospital, we have to go see those patients. So, you know, the emergency room will work them up, see if it's something that they can just be treated and go in the ED. But if it requires more of a hospital workup in which they have to stay inpatient, then they stay. We're gonna sneak into the ED from the back way. Get the patient's water when they ask for it. Let me show you guys how old this hospital is. Phone booth. Let's check this out. What? Like, what is this, you guys? Hello? Dr. Carter. Some very exciting news, you guys, is that my HIV patient, who we actually did discover has AIDS. AIDS is when you have a CD4 count of less than 200. Ooh, I'm winded.
May have the intention to leave. Second call, medical alert, adult cardiac arrest, and DS in Delta 7.
Adult cardiac arrest, that means somebody's coding. So we go here. Oh my God, you guys. Oh my God. That was nuts. So I was literally just on my way to see my patient on the 8th floor, and I heard the adult cardiac arrest. The medicine team responds to those. So I figured that my team would probably end up there. So I just went just to check it out, see what's going on, you know, try to learn as much as possible. And it was this 67-year-old male that went into cardiac arrest. His heart stopped, you know, no pulses, whatnot. So I'm standing outside of the room, you know, just being a medical student, like peeking over all the shoulders. The room fills up so fast with people, you guys. There's like nurses, doctors, like everybody responds. So there's like 20 people, I kid you not, in a small one-person hospital room. So anyway, I'm just outside of the door, peeking over, like trying to see what I can. People are doing compressions. People are, bagging him to give him breaths, all of this stuff. And one of the residents, he kind of like sees me outside and he was like, have you ever done chest compressions? And I was like, not on a live body. Like what? On the dummy when you have to get certified. That's about the extent of my training in CPR. And he was like, you should go, sneak around the back, get in the line, and they switch out. Every time someone's tired, they switch out. So you should get that experience if you want it. And I was just like, yeah, absolutely. And I continue to stand outside the door, like peeking in. And it seemed like we were outside of the room forever. When a heart isn't beating, like minutes feel like hours. So maybe about 5 minutes went by. So at some point it clicked in my mind that I was just like, I want to get this experience. You know what I mean? Like I want to be able to say that I played a part in a code and I'm no longer shadowing you anymore. Like I'm not a pre-med student anymore. I'm a medical student. I'm going to be soon a resident. So it was just like, Julia, get in there. So I put on some gloves and my resident was like, do you want to do compressions? And I was like, yeah, but I've never done them. He's like, we're going to coach you through it. And when one person's doing compressions, you let them know you want to, so you can keep the rhythm. So 1, 2, 3, and you swap out on a count. So I swapped out and I started, and it was just like your hands going into a live like chest and feeling it is just such a different experience than practicing on a dummy and, getting the certification. It's just really nothing like feeling like a live body underneath your hands as you're literally like pounding on their chest to essentially bring them back to life. So I did maybe like 30 seconds and I started breaking a sweat. Like I'm sure my calorie count is skyrocketed today, but they were like, you getting tired? And I was like, yes, like I'm not cut out for this. I wasn't prepared. I didn't train, yesterday. So I swapped out. And this man was just not coming back, you guys, like pushing epinephrine, pushing Bicarb, giving him all these drugs. And, every so often we would stop and do a pulse check and no pulses. I think they did like 8 cycles of whatever that means, I guess rounds of drugs and compressions and all of that. And they started saying like, anybody have any thoughts? Do we run through everything? Hypoxia, heart stuff, acidosis, like all of this stuff, and nothing was happening. So they were just about to call it, like literally pronounce him dead. And they saw some rhythms on the heart, the monitor, and they thought that maybe it was just residual from us pounding on his chest, but the person who was an expert in that was like, nah, this isn't typical of just, incidental kind of from the compressions. So they were like, let's do one more round. Let's do one more round of cycles. So started chest compressions again, right? And they put me on, so I think just to give me the experience of maybe like losing a patient. So they put me on and I did, chest compressions, and then we stopped to do a pulse check, you guys. And he had pulses, like came back to life. And they all look at me like, it was you, like your compression. I'm like, stop, like stop. But like he came back, like he has pulses. And then they got him on a ventilator and he's probably going to go to the ICU. But essentially all that to say, like that last cycle wouldn't have happened if we would have just stopped. You know what I mean? Like just gave up. And who knows what's going to be like the state of his well-being, his health, being that he did suffer a cardiac arrest. He was not breathing, not having any pulse for some time. But it was just crazy. It was so crazy to be a part of, you guys. And like, I'm so glad that resident outside the room like pushed me and encouraged me to be a part of that, because it was like mind-blowing, mind-blowing. And I'm so glad I had that experience. And whoa. In other exciting news, you guys, my AIDS patient, my HIV patient that I was telling you guys about maybe a few days ago, he's been here for 9 days and he is going home today. So we finally got him in, treatment, and he's willing to start taking antiretroviral medications when he leaves. So he's leaving and he's going home. He looks so much better. He feels better. he was depressed even, so we started him on depression medications, and it's just amazing to see like a patient. I was here when he came in the first day, and I'm here when he's leaving and he's better. So it's just so rewarding to see, you know, patients come and go, and they come when they're sick, you help them, and they leave when they're better. So yeah, love to see it.
Good morning, guys, and happy Friday. So it's 6:45. I'm actually headed to the hospital a little early today. It is my last day for this week on this block. So my internal medicine rotation is broken up into 3 blocks of 3 weeks. So it is my last day on this first 3-week block. So super excited, dressed up for the occasion. I'm glad to be done and moving on to something else. I actually love the experience, but I always love like switching it up and doing new things. So yeah, so I'm headed a little early because of course on my last freaking day I have 2 really complicated patients to present, and the worst thing you could do on internal medicine is be unprepared. Be unprepared to present your patients and not know what's going on with them is a really bad look. It essentially means you didn't do what you were supposed to do. Like, you had one job, and that's to know your patients and be able to present them on internal medicine. And so because of the complexity of these patients, I'm just gonna head there a little early just so I could, you know, do a little more research, look up a lot of stuff, just so I seem like I know what I'm talking about. It's not always that I know what I'm talking about, but as long as I appear like I do, it's received well. So yeah, let's hope it's a good Friday. A great thing about internal medicine is that because it is such a broad category and it covers so many diseases, you learn how to manage those independently. However, sometimes you do have to send a consult to another specialty or another service because it goes beyond, you know, your expertise. So if you need plastic surgery to consult or gastrointestinal to do something in the stomach, then you send out, you know, the call for those doctors to come in and do what they do best. So today I had a patient who was a young woman, a young 30-year-old woman who had come in that had complications from a BBL surgery. BBL standing for Brazilian butt lift. She had just had one 2 weeks ago and now is having complications of the surgery. She has an infection on her butt, swollen, red, inflamed, and also in her blood it's showing that it might be spreading into her bloodstream, causing what's called sepsis, which is an infection of your blood, of your bloodstream. So I went to see her, I did a physical exam, her butt looks very swollen, very red, and I just wanted to touch on this a little bit because I know that surgeries, especially cosmetic surgeries, are so popular these days. I know we see it saturated on our social medias, on, you know, Instagram, all these celebrities popping out with these bodies, amazing bodies. And I know it's very tempting, and I know that, you know, it seems as though it's just, oh, go to the surgeon, get it done, another day in the park, I'll heal a little bit and I'll be back on, you know, back running the streets in 2 weeks. I'm out here. And it's just like, guys, please keep in mind that these are very invasive surgeries. Tummy tucks, liposuction, BBLs, like these are very intensive surgeries. You are under general anesthesia. They are poking, prodding, like there's a high susceptibility for post-op complications and infections. And you need to take it like very, very serious, and especially weigh all of these options when considering a surgery of this magnitude. It should not be taken lightly. We see people coming in with complications that literally can cause death. Infections in your bloodstream like can cause mortality, cause you to die. So please just keep this in mind and don't think that it's just you know, easy breezy walk in the park with the peaches and the flowers. It's absolutely a huge risk that these surgeries are bringing to you. I'd show pictures, but I didn't want to be all up in her butt, you know, like taking photos. So just know that it didn't look great, you know, and it's like, who wants to go through all of that, all of those surgeries, all of that healing and whatnot, only to have a complication that could possibly disform you or disfigure you, you know, or end up not even being what you wanted. So just please take it serious, you guys.
So I am done for the day, you guys, done for the week, actually. Finally finished Friday. It is 3 p.m. The sun is out. It is 70 degrees out. Like, you can't beat it. You can't finish the week on a higher note than this, right? So I feel like this week I saw a lot of interesting stuff, like, you know, and I included a lot of the interesting stuff in this video, but there was more too that I just didn't film, or that I didn't, you know, show you guys, or this video would be hours long if I ran you through all of my interesting cases and patients. But overall, it was a really great week. I'm 3 weeks into my internal medicine rotation. I'll be beginning my 4th week next week. And one thing about internal medicine that I love is, you know, well, some people don't love it, but it's so broad. You're seeing so many different illnesses and diseases, which means that there's a lot to know and a lot to learn, which, you know, could be a double-edged sword, because who wants to study for all that? There's so much you have to know in order to present a good patient and stuff like that. But at the same time, you learn so much so fast, you guys. Like, 3 weeks in, and I look at myself now compared to like my first day on internal medicine, and it is like a complete 180, you know, like I just feel like I know so much more, even though I do know that there's still so much more to know. I definitely feel as though my knowledge has, you know, expanded significantly on this rotation thus far. And I love that, because one thing as a medical student you fall into the habit of is like thinking that you don't know anything, like realizing how much you sat in the classroom and really didn't know how to practice what you were learning. So I like that I finally feel like I'm in a place where I'm useful and I like know stuff and I know how to answer questions, and it's like, whoa, I'm not used to this, you know? So yeah, so that's really great. But yeah, I hope you guys enjoyed this video. It was a lot. There's so much that goes into internal medicine and the patients and how many diseases there are, medications, all that stuff. But hopefully you guys enjoyed it, found some value out of it. It's been a while since I had posted a Rotate With Me vlog. So yeah, be sure you give this video a thumbs up if you guys enjoyed. Hit that like button, subscribe, hit the bell so you're tuned into all the content that's dropping, and I will check in with you guys soon. Love you guys.